I took a trip out to Waterford Hospital this morning to show my support to all of the nurses and midwives in Ireland who have now literally been left with no option other than to commence strike action in Ireland today.
My name is Mary Don. I'm a clinical nurse manager in the emergency department of University Hospital Waterford. I've worked there for quite a considerable number of years, and in recent years we've seen our department get busier and busier with more patients staying overnight on trolleys for considerable lengths of time out on corridors waiting admission to the ward. We're out here today with the INMO in dispute looking for fair pay. Our nurses here on the line are saying be fair to those who care. We want to be paid the same money as our allied health professionals, our physios, our OTs, our speech and language therapists. We're all now trained at 4-year degree. We all leave college with that degree, but the nurses are paid considerably less. So we are looking for pay parity. We see the nurses that train in this country leave this country. Why do they leave this country? They leave this country because they're paid not enough to stay here. They leave this country because they can go and work in safer conditions where the number of nurses per patient is considerably less. So we are here today looking for pay parity with our allied health professionals, and we ask the government to please listen to our claim. They haven't listened. We should not be out on strike today, and there's not one nurse walking this line today that wants to be here. We want to be in looking after our patients. That is our job. That's what we want to be doing, but we want to do that safely. And I as a nurse would like to think I'd have a nurse to look after me when I'm older. But there is a problem with retention and recruitment in this country. For every 4 vacancies there's 1 applicant. So, you know, there's 1.3 million a week spent by the government on agency to fill the gaps in our rosters, to keep enough nurses on the ward to mind the patients. And that cost 100 million last year was spent on agency nurses. So we want that money paid to our nurses to stay here. Mr. Varadkar mentioned he wanted to be fair to the taxpayers yesterday. Well, we are taxpayers. The patients we look after in this country are from this country, have paid their taxes as well. So we want to be fair to the taxpayers too, and we want to give the taxpayers adequate care when they come into hospital with a sufficient number of qualified nurses. We want to also be fair to the mothers and fathers of this country who put their children through college to be nurses. They too are taxpayers. So pay those nurses fairly and on par with our allied health professionals, and this dispute will be over.
Thank you.
Be fair to those who care. Be fair to those who care. Be fair to those who care. Be fair to those who care.
The trolley numbers of admitted patients in the emergency department are escalating year on year. And this year in January there was one day where there was 601 people in the country on trolleys awaiting admission to hospital beds. That was only 2 weeks ago.
Oh my God.
You know, and that's a significant number. That's like a whole hospital of patients. So there is the other issue of needing to address the bed, the number of beds per population, you know, in the country.
But where do you think it'll go? What's your opinion on it?
Well, my opinion on it, I don't know where it'll go. But we as nurses, we're going to stand firm. Our nurses are very, very angry that the politicians to date did not listen to us. We're very annoyed that the Taoiseach's office and the Department of Public Expenditure weren't available to the President of the General Secretary of our organisation last Friday. You know, and that's led us to being out here. There hasn't been adequate discussions. There's been no proposal that can be put on the table at WRC. So we'll be here to see this out. This is the end of the line for us now, and we want it resolved, and we want to get back working as soon as possible.
Of course, I mean, it's only the second time in the history of the INO that there has been a strike, so it's not as though you do this lightly.
We did not take this lightly, but a huge majority of our members voted in favour of this action, and it is the end of the line for us. You know, it's in the interest of us being treated fairly, and it's the interest of us being able to have a sufficient staffing levels on our wards to look after our patients safely.
Yes, I understand.